Sleep issues significantly impact learning and memory. Sleeping triggers the synapses in our brain to both strengthen and weaken, which prompts the forgetting, strengthening, or modification of our memories in a process known as long-term potentiation, otherwise known as LTP. Sleep can have completely different effects depending on whether LTP is present or not. A lack of LTP leads to memory erasure, while the presence of LTP can either strengthen memories or prompt the emergence of new ones. The neurotransmitter dopamine plays a key part in learning and memory retention. Dopaminergic activity is known to regulate the ability of the brain to change in direct response to learning and memory formation. Sleep decreases signaling activity by dopamine, while at the same time enhancing memory retention. Decreasing sleep stimulates dopamine signaling and accelerates forgetting. Memory consolidation is a process by which previously learned information is transferred into long-term memory storage. A type of brain activity that occurs during sleep in the hippocampus and is known as sleep spindles plays an important role in this process. Sleep spindles are measured by electroencephalograms, or EEGs. The more sleep spindles a person has, the greater their memory consolidation is. Sleep after learning encourages the growth of dendritic spines, the tiny protrusions from brain cells that connect to other brain cells and facilitate the passage of information across synapses, the junctions at which brain cells meet. Moreover, the activity of brain cells during deep sleep or slow wave sleep after learning is critical for such growth. Brain cells in the motor cortex that activate when learning a task reactivate during slow-wave deep sleep. Disrupting this process prevents dendritic spine growth. Memory consolidation inhibits wakefulness when the process of converting short-term to long-term memory begins. This is likely why people get tired after periods of extensive cognitive engagement. This is also why it's important to sleep if possible if you feel tired after learning something. Some other research on learning and memory shows more distinctly how our long-term memory is consolidated when we sleep. Short-term memories in the hippocampus, an area deep in the brain, are relocated to more outer parts of the brain. A team of neuroscientists found how a three-step brain oscillation plays an important part in that process. Non-rapid eye movement, or NREM, sleep is responsible for the memory consolidation during our sleep. NREM is known for its very slow oscillations. Other types of oscillations are hidden inside these slow ones. The researchers discovered that three types of oscillations are nested inside each other in the hippocampus and have a joint function. Another set of studies on memory showed that subjects' memories and novel problem-solving skills were superior when sleep occurred shortly after learning, rather than following a full day of wakefulness. This confirms that sleeping directly after learning something new is beneficial for memory. It appears that an effective learning strategy is to review material intended to be remembered shortly before sleep. Yet another study showed that rule-based learning is enhanced following a night's sleep. Another piece of research studied how napping affects memory retention. Even a short sleep lasting 45 to 60 minutes produces a 5-fold improvement in information retrieval from memory. This shows that even short naps are enough to significantly improve learning success. Sleeping not only protects memories from being forgotten, it also makes them easier to access. Sleep almost doubles our chances of remembering previously unrecalled material. The post-sleep boost in memory accessibility may indicate that some memories are sharpened overnight. This supports the notion that, while asleep, we actively rehearse information flagged as important. A study with over 15,000 female participants showed that women who slept 5 or fewer hours, or 9 or more hours per day, either in midlife or later life, had worse memory, equivalent to nearly 2 additional years of age, than those sleeping 7 hours per day. Another study with approximately 5,000 women and 4,000 men from the ages of 50 to 89 years old had similar results. It showed that less than 6 hours of sleep a night, or more than 8 hours, significantly negatively impacted cognitive brain functioning. Research has also shown that sleep impacts decision-making. Investigations into the Chernobyl nuclear power plant meltdown, the grounding of the Exxon Valdez oil tanker, and the explosion of the Space Shuttle Challenger all concluded that sleep-deprived operators played a role in causing the accidents. Sleep loss has been shown to prevent effective use of feedback to correct actions. Poor sleep can also have a negative effect on self-control. Sleep-deprived individuals are at increased risk for succumbing to impulsive desires, inattentiveness, and questionable decision-making. Another study has shown that people with insomnia cannot modulate activity in brain regions typically used to perform tasks. As tasks get harder, good sleepers use more resources within the working memory network of the brain, especially the prefrontal cortex. Insomnia subjects, however, are unable to recruit more resources in these brain regions. Furthermore, as tasks get harder, participants with insomnia cannot dial down the default mode regions of the brain that are normally only active when our minds are wandering. In other words, their brains are not functioning as efficiently during the day. Many of us try to catch up with lost sleep on the weekends. The usual practice of extending sleep during the weekend after a busy work week where we don't sleep enough is not adequate in reversing the cumulative effects on cognitive function resulting from this mild sleep deprivation. Another study found that performance decreases significantly after 6 nights of sleep restriction and did not improve after 2 nights of recovery sleep. Sleep restriction also caused subjective and objective sleepiness to increase significantly. However, sleepiness did improve after recovery sleep. The study also found significant gender differences. Compared with men, women were found to have less subjective sleepiness and less performance deterioration during sleep restriction, as well as greater improvements after recovery. These differences were associated with increased amounts of slow-wave sleep or deep sleep in women at baseline. Women with a higher amount of deep sleep can handle better the effects of 1 work week of mild sleep deprivation, and their recovery is more complete after 2 nights of extended sleep. A full night of sleep with multiple interruptions also negatively affects people. In a study, investigators established a direct causal link between interrupted sleep patterns and compromised cognitive abilities, shortened attention spans, and negative moods. Another study showed how a lack of sleep increases our recall of memories when we are under stress. Other research has shown that lack of sleep impacts our ability to accurately distinguish between threatening or friendly facial expressions. In fact, people that are sleep deprived have a greater tendency to rate facial expressions as threatening, even if they are in actuality neutral or even positive. Being sleep deprived, therefore, can impact our social interactions. Other research shows that sleep facilitates problem solving, but this has its primary effect for harder problems. This sleep effect is greatest when the problems facing us are difficult. Sleep appears to help us solve problems by accessing information that is remote to the initial problem, that may not be initially brought to mind. Sleep has been proposed to spread activation to the solution that is initially distant from our first attempts at the problem. The advice stemming from this and related research is to leave a problem aside if you're stuck, and get some sleep if it's a really difficult problem. Sleep issues play into the development of psychosis. Individuals with insomnia are 5 times more likely to have high levels of paranoid thinking than people who are sleeping well, and over half the individuals attending psychiatric services for severe paranoia were found to have clinical insomnia. Another study of sleep's impact on psychosis showed desynchronization of the waves of activity which normally travel from the front to the back of the brain during deep sleep. In particular, the information flow between the hippocampus, involved in memory formation, and the frontal cortex, involved in decision-making, appears to be disrupted. These irregular sleep patterns are very similar to those observed in schizophrenia patients. The decoupling of brain regions involved in memory formation and decision-making during wakefulness are already implicated in schizophrenia, but decoupling during sleep provides a new mechanistic explanation for the cognitive deficits observed in patients, and therefore sleep disturbances might be a cause, not just a consequence, of schizophrenia. In another study, healthy volunteers were sleep deprived for 24 hours and then had numerous tests performed on them which showed that they developed symptoms similar to schizophrenics. They were more sensitive to light, color, and brightness. Accordingly, their sense of time and sense of smell were altered and mental leaps were reported. Many of them even had the impression of being able to read thoughts or notice altered body perception. Those with sleep disorders struggle to regulate their emotional responses compared to those without sleep issues. The amygdala, located in the temporal lobe of the brain, plays an important role in emotional processing and regulation. Amygdala activity has been shown to be greater for insomniacs than for those without the sleep disorder when attempting to reinterpret emotional material. The inability to regulate emotions can also lead to insomnia. One study showed that participants whose ability to regulate their emotions had diminished over time were more likely to have developed insomnia, and that it was more likely to be persistent. These researchers found that a reduced ability to regulate emotions was associated with an 11% increased risk of developing a new bout of insomnia or reporting persistent insomnia. Sleep issues also play into the development of depression and anxiety issues. A study of over 25,000 participants showed significant relations between the longitudinal course of chronic insomnia and the development of anxiety disorders and depression. Compared to the group of participants without chronic insomnia, the group with chronic insomnia had increased associations to having developed anxiety disorders and depression. In addition, those with higher life satisfaction reported shorter times to fall asleep, known as sleep onset latency. These findings support the idea that life satisfaction is interlinked with many features of sleep and sleep quality, suggesting that improving one of these variables might result in improving the other. Another longitudinal study looked at insomnia's long-term development and effects on depression. It found that in 40% of subjects, insomnia developed into more chronic forms over time. Insomnia either with or without comorbid depression was highly stable over time. Insomnia lasting 2 weeks or longer predicted major depressive episodes and major depressive disorder. 17 to 50% of subjects with insomnia lasting 2 weeks or longer developed a major depressive episode, reported in a later interview. Insomnia seems to be followed by depression more consistently than the other way around. In addition, insomnia tends to be a chronic problem that gets more persistent over time, whereas depression was a more intermittent problem. Another study of almost 2,000 adult twins is the first to demonstrate a gene and environment interaction between sleep duration and depressive symptoms. Results suggest that sleep durations outside the normal range increase the genetic risk for depressive symptoms. Among twins with a normal sleep duration of 7 to 9 hours per night, the total heritability of depressive symptoms was 27%. However, the genetic influence on depressive symptoms increased to 53% among twins with a short sleep duration of 5 hours per night and 49% among those who reported sleeping 10 hours per night. This shows that both short and excessively long sleep durations appear to activate genes related to depressive symptoms. One study found that sleep deprivation affects facial features such as the eyes, mouth, and skin, and these features function as cues of sleep loss to other people. Results show that the faces of sleep-deprived individuals were perceived as having more hanging eyelids, redder eyes, more swollen eyes, and darker circles under the eyes. Sleep deprivation was also associated with paler skin, more wrinkles or fine lines, and more droopy corners of the mouth. People also looked sadder when sleep deprived than after normal sleep, and sadness was related to looking fatigued. This is important because facial appearance can affect judgments of attributes such as trustworthiness, aggressiveness, and competence. A study of nearly 14,000 participants suggests that symptoms of depression and insomnia are the strongest predictors of having frequent nightmares. Results show that 3.9% of participants reported having frequent nightmares during the previous 30 days, including 4.8% of women and 2.9% of men. Frequent nightmares were reported by 28.4% of participants with severe depressive symptoms and 17.1% of those with frequent insomnia. Further analysis that adjusted for potential confounders found that the strongest independent risk factors for nightmares were insomnia, exhaustion, and the depressive symptom of negative attitude towards self. Occasional nightmares in the past 30 days were reported by more than 45% of participants, and 50.6% reported no nightmares at all. Poor sleep quality and bipolar disorder appear to exacerbate each other. Previous research shows that poor sleep quality is a symptom of depressive and manic episodes, and that lack of sleep can trigger mania. For women, poor sleep quality predicted increased severity and frequency of depression and increased severity and variability of mania. One study attempted to clarify whether self-reported sleep disturbances serve as a risk factor for suicide ideation in young adults. It found that insomnia and poor sleep quality jointly predicted elevated suicidal symptoms, even after controlling for depression. However, these sleep complaints failed to individually predict increased risk for suicide. This suggests that, within a less severe sample, multiple indices of sleep disturbances may be necessary to assess suicide risk and guide clinical decision-making. Another study found that alcohol use was significantly associated with suicide risk among women. However, further analysis revealed that insomnia symptoms explained a significant proportion of the relationship between alcohol and suicide risk. For men, there was no direct effect of alcohol use on suicide risk, but there was a significant indirect effect of alcohol use increasing suicide risk due to insomnia symptoms. For both men and women, insomnia symptoms explained a significant amount of the variance in the relation between alcohol use and suicide risk. Veterans of the armed forces often experience significant sleep issues. A study of returning Operation Iraqi Freedom veterans showed that they endorsed significantly more severe disruptive nocturnal behaviors, such as nightmares and body movements, than patients with insomnia. Insomnia complaints in returning veterans were as severe as complaints endorsed by insomnia patients. Sleep quality was significantly worse in veterans than in good sleepers. Another study of over 2,500 Iraq and Afghanistan military vets showed that 63% of participants endorsed poor sleep quality, which was negatively associated with resilience, which was defined as positive stress coping ability. Longer sleep onset, lower sleep efficiency, shorter sleep duration, worse sleep quality, and greater daytime disturbance were each associated with lower resilience. Indices of insomnia in early recovery may be 5 times higher than the general population and may persist for months to years. Insomnia may be linked with a higher risk of alcohol-related problems and relapse. The association may run in the other direction as well. Studies report people with sleep disturbance are more likely to be at risk of developing addiction. Compounding the problem, some patients addicted to alcohol use the substance in the evening in an effort to address sleep problems. Alcohol is a well-documented cause of sleep disruption, with toxic effects on several neurobiological systems, and may contribute to lasting sleep problems even during abstinence. Researchers note that clinicians should be cautious when prescribing medications to address insomnia in the recovering patient. This population of patients may be at increased risk for misuse, abuse, or addiction to sleep medications, or prone to rebound insomnia after medications are discontinued. In short, use of such medications may increase the risk of relapse. The researchers instead encourage the use of behavioral strategies to treat insomnia, which will be discussed later. Sleep paralysis is a common and disturbing phenomenon associated with sleep, even in those that do not experience insomnia. Sleep paralysis typically occurs when someone is falling into or coming out of sleep and is characterized by feelings such as fear, terror, a presence in the room, or imminent death. Physical sensations such as chest pressure, inability to breathe, floating or falling, and dissociative or out-of-body experiences, all coupled with a person's complete inability to physically move. The sensory experiences that come with episodes of sleep paralysis could exacerbate people's fear, creating a feedback loop that enhances memories of experiences later on. Post-episode distress was also associated with a number of individual level factors, including cognitive style, distress sensitivity, and supernatural beliefs about sleep paralysis. People who held supernatural beliefs about sleep paralysis experiences also experienced greater post-episode distress. Those who had more analytic cognitive styles, on the other hand, experienced comparatively less distress after sleep paralysis episodes. Taken together, these findings show that both situational factors and individual factors contribute to these common and often stressful personal experiences.